Thanks, Linda. Hi, it's Hillary. Thanks for joining us for this month's faculty meeting. Today we have Shane, who is the Director of Training of Business Development at Boiron. So welcome.
Thank you.
You so much for being here.
Thank you. Thank you, Hillary. Thank you, Linda, for helping to pull all this and organizing it together. And good morning, Mr. Sitkoff. I'm going to assume that you are a pharmacist and obviously a member of the ACA, so thank you for your time today. I think we'll just get started with this as, and whoop, there's more people coming in. Welcome, welcome. Good day. So we were just beginning, if I pronounce your first name correctly, Ome?
Correct. Ome.
Did I get your first name correctly?
Yes, you did.
Oh, good. Off to a good start then. Well, welcome. Thank you for your time. And the presentation is going to be both some very practical options and support options for the allergy season using homeopathic medicines. Before we get to that, I am going to do a snapshot recap of essential knowledge, some of the frequently asked questions and little known facts in some cases of homeopathy here in the United States today. So I'm going to share my screen. I'm going to jump in, and then I really encourage you, since we have a small group, stop at any moment that you have a question and just shout out, say, I don't need to move any further. I got a question before we proceed, and I'm going to be happy to do that. By way of introduction, and I will get started here in just a moment. We're going to have to go back to the beginning here. And again, Hillary, question, are you seeing the presenter mode or no?
We are seeing the correct way.
So it didn't switch off when we bounced out. All right, good. Well, again, thank you for joining us. Pictured there on the left is a rather extensive set of medicines just from Boiron. It's only one of several homeopathic companies reliable in this country. And today's topic is going to be, what can we do for our patients during the allergy season? Should we even be doing it? And if so, what are the reasons for taking a look at this? By way of introduction, Hillary was gracious enough to introduce me. I am Shane McCamey, Boiron USA, and I'm the Director of Training and Business Development. Boiron's pharmacy development team has a dual track, so we're both have a non-commercial educational track, which we have had real success in reaching into the schools of pharmacy, while also having business development training options for the retail independent community pharmacists like yourself. I'm an educator here for both the pharmacy and medical team. And prior to my 30 years here with Boiron, I was the manager of operations at Capital Drugs Integrative Pharmacies in Los Angeles. I was there about 6 years. Wonderfully successful. And we'll talk more about integrative pharmacies as we move through. But during that time, we had everything on our shelves. If it was medicine on planet Earth, we had it. And it ran from Ayurvedic medicine all the way up to zinc tablets. But in the middle of it, I chose to study in depth the homeopathy. And I attended the Pacific Academy of Homeopathic Medicine. It was located in Northern California. It was a 3-year program, which required I get on an airplane one weekend every month, fly up to San Francisco, and attend 2.5 days of study. It was incredibly valuable, but the real heart of this was that I returned to a pharmacy, a community pharmacy, where I got to employ the learnings of the weekend. Since then, I've used it in 5 generations of my family. For today, our learning objectives are just go over, like I said, a few of the frequently asked questions that you're going to get in your pharmacy. I want to make sure that even though we have less than an hour together, that I leave you with absolutely reliable reference materials. And then just touch on the benefits and advantages of homeopathic medicines, and then just get straight to a few real pearls for this allergy and summer season that's soon upon us. And I did write down there, is there actually a homeopathic medicine that helps mosquitoes from biting? And the answer is yes, there is. For all of you, even though you're looking at this screen and that there is a QR code, you can take a shot of it now and download this comprehensive. It is an enormous work by our pharmacist in charge, director of pharmacy, Christophe Merville, as well as 2 other American pharmacists. It is a whole lot more than you'll probably need for some time, but this PDF is going to be sent out to you, so don't feel like you have to grab your phone right now and urgently do it. You'll be able to grab this at a later time. This is just one of the tools that Boiron makes available to you, and the little clever title there, Teaching the Tools, is absolutely essential because you're going to spend most of your pharmacy life away from us, even though I hope you always think of us as your first resource in this field. Next, we do have a website, a Pharmacy Resource Center, and you can go there and find a whole variety of assistance. I'm also going to show you this book. It was, by the way, written by Michelle Boiron, the name you see up here. She is the daughter of one of the 2 brothers who founded our company. She ran a remarkably successful community pharmacy in Lyon, France, which is where our main laboratories are. And this book is one of my absolute favorites. I'm clicking on it right now to see if it'll come live. But again, I will make an electronic version of this available to you through Hillary and Linda. Very importantly, for easy use is a medicine finder app that we created. It was really meant for lay customers, so for your patients, your customers, and we have little signage for them to download it in your pharmacy, but it is very useful for the everyday person. A boiled down version of what Michelle Boiron's book and certainly that comprehensive guide that's available to you as pharmacists. All of these are tools. It is really quite easy and user-friendly, and they'll be in the PDF that gets sent out to you. So next, well, this is just there's a lot of different conditions that are addressed, especially acute care with homeopathy, as well as acute exacerbations of some chronic conditions. But you will find, I hope, at the end of our little bit of time here together, some measure of inspiration to follow through and take a look at all the new potential there is in patient care through homeopathy. We also have monographs available on almost everything you're going to see today. Very quickly about the company. Twin brothers, both pharmacists, both French, created the company over 90 years ago now. And these twin brothers were remarkable in their efficiency and precision. Now, here we are 90 years later, we are in 60 countries, our medicines are found, and we have 20 subsidiaries or headquarters. United States is one of them, Canada, France, Italy, India, Brazil, and others. At each of these subsidiaries, they are led by pharmacist CEOs. We are very much a pharmaceutical company. And then part of our mission, of course, is to make sure that the research and the education that is necessary to follow up with our mission is executed, which is why we're here today. We're rather proud of this. I won't spend a lot of time, but the Environmental Stewardship Award that we've been awarded is essential because all of our medicines really come from nature for the most part. And we are vigilant and concerned about environmental impact and being very careful to maintain our future sources. And then importantly for pharmacists, the US FDA, as you'll see in a moment, regulates homeopathy, and they come to our facility. They travel to France. We are, I believe, the only homeopathic laboratory to never have received any warning letters. When I tell you that the pharmacists and the pharmacy tradition at Boiron is severe, it is strict. And for this reason, we get to make out this claim that we do not receive warning letters to date. Cross fingers. Important here for the pharmacist, of course, is that homeopathic medicines, which are different, they're categorized differently from the herbs, vitamins, supplements, plant proteins, probiotics, everything else that you find in a natural health setting. Homeopathic medicines are and have been regulated by the FDA since 1938. The Food, Drug, and Cosmetic Act was signed into law by Franklin Roosevelt between World War I and World War II, and we have enjoyed this special status because even though we're not going to have a history of homeopathy included, by 1938, homeopathic medicine had already been practiced in the United States for over a century. And so you're going to find that, as some of you probably have homeopathic medicines in your pharmacies, I know that Hillary does, almost all of them are OTC, but there are a few homeopathic medicines that are by prescription only. And if anybody wants a full list of all of the medicines that are available from Boiron here in the United States, I can send you that PDF as well. Shall I make a note of that, Hillary, just so that you have it on hand? All right, all available. It's an easy reference. So now a definition. And believe me, in my pharmacy in my years, I found that there wasn't a day went by that a patient didn't come in and say, all right, all that stuff behind you there, what is it? I see the word homeopathy, but what is it? Well, it actually is admittedly a dreadful word that has a very crisp and clear definition. It is a therapy. We use natural substances, but the unique manufacturing process puts it in a microdose form to relieve a whole host of different types of symptoms. That's what it is. If you say this sentence to your patients, they get it. It's a therapeutic medicine, natural substances in a microdose, and it helps you. Moving on, there is a principle of similars. Hillary earlier used the term like cures like. And remember microdose because we're going to hit on this note a couple of times. But the principle of similars is one of the guiding principles of the science. And there's really only two. But first, let's use our imaginations and imagine that a woman comes to your pharmacy and on this day, she was stung by a bee. Now we know what happens when you get too much bee venom injected into you on a spring day. She is unfortunately suffering from some swelling. It's pinkish red and discolored. Uniquely, bee stings sting and itch. And they always feel better if you can put a cold cloth, run it under cold water, or an ice cube on it. You don't want to put hot anything. So now, obviously, if this woman in distress comes into your pharmacy and you happen to have on your shelf the homeopathic medicine made from the honeybee called Apis mellifica, the Latin nomenclature is used here, then you can give this to her in a recommendation, and it will relieve those same symptoms that are pink, edema, stinging, and itching. And so now is a moment to pause and remember that this is a principle of similars, not a principle of exact. So we're not limited in the use of Apis mellifica in just a bee sting. It's any kind of condition that is similar in its symptom presentation in a human being that looks like a bee sting. So we said, we do know that there's a bee sting, but we ask what else is similar to that in its presentation in us. There are rashes, there are hives that come on suddenly. They're pink, red, sting, itch, and it definitely feels better if you run it under a cold running water. What about sunburn? Now, if you are prone to sunburn and you're foolish enough as a teenage boy to fall asleep in the sun and you get up, there is that awful stinging, but it also itches, but you can't touch it. And you would never get in a hot shower from relief. You would get into a cool shower and let the water come down over top of you. Apis mellifica is a medicine for sunburns. Herpes outbreaks, cold sores. Again, a lot of people will complain and they will come on suddenly, just like a bee sting. They sting, they itch, and it feels a little bit better if you can put anything cold on it. So Apis mellifica can be used in certain herpetic outbreaks. And then you have a whole host of similar conditions that can be treated with a single medicine. Now, on to the benefits and advantages, because this might be the most important slide for a pharmacist, which is There are no known interactions with other treatments or therapies. The job of a pharmacist is to be the gatekeeper for what are often or always multiple and sometimes dangerous medications. There are restrictions on every patient if they take multiple medications. And we all have had occasions where someone comes in, they need assistance. They're asking, is there anything else? Because whatever they're doing is not working sufficiently. In my time at Capital Drugs, I think we pretty much settled that the only answer we would give is yes, homeopathy. It wouldn't make any difference the age or the medication, but being able to provide secondary supportive assistance is what homeopathy could do. And obviously, if they're on a number of prescription drugs, but also for the person who is just honestly, a vitamin junkie, people who take so many things that they say, now I want something else for an acute crisis, this is a time to layer in a homeopathic medicine. Other benefits that have been shown over the course of more than 200 years is it works. The materials available to support this from the veterinary world, oncology, pediatrics, gynecology, etc., are overwhelming. There's no known side effects. And here we can check the FDA logs and we respond to every remote concern there is, and we respond in full. Our pharmacist, Christophe Merville, is always happy to hit on this specifically if you have questions. Homeopathic medicines, like we were talking about the bee sting, should be fast acting, but the action should match the onset of the issue. And it really is a medicine for all ages, for the most part. I'm not going to spend too much time on this, but only to let you know that as you advance in this, you will see these different potencies or dilutions of homeopathic medicines. And there is a general wisdom to when you choose a lower number, like a 6C for more localized symptoms, that's the low. More localized symptoms, you use a 6C. And then if the issue and symptoms expand to include general symptomology as well as behavioral, you simply have more symptoms, you use a larger number. I'm going to let that go right now because it's kept fairly simple, but still rule number one, get the right medicine. Afterwards, choosing the dilution is simply a matter of fine tuning. This is a scale that you can reference down the road, but I don't think we need to spend time on it right now. The scope of practice for homeopathy in pharmacy is considerable. And the more comfortable you are with your level of expertise in homeopathy, the more occasions you're going to find for the inclusion of at least the consideration of homeopathic treatment. At the top there, you see it can be used alone. It is possible, like we just said in the bee sting, that if someone comes in and you're quite sure that it matches completely, you only need a homeopathic medicine for that. There might really not be, you might not need calamine lotion or anything else on top of it. But there are many occasions where you can use homeopathic medicines besides just a traumatic injury. You see here stress and anxiety, a variety of female health issues. And it can be whether it's a pre-existing condition or not. I used the term earlier, acute exacerbation of a chronic problem. So if your grandfather has arthritis, and when the weather shifts and turns cold in November, and the arthritis pain flares, and he is just so stiff when he gets out of his TV chair, homeopathy will not cure arthritis, but it can certainly bring him relief for that November time when he is at his worst with the pain. In association with other medicines. And this is the second one listed here, the treatment of the recurrence of ear, nose, and throat and urinary infections. In my pharmacy there at Capital Drugs, we gained a tremendous population base simply because of helping the infants, the young children of new moms and dads. Because it was a typical scenario to have someone come in and they simply report that either the antibiotics aren't working that well, or it's the third round of antibiotics, or this is the third time this season. And there are ways to help, first of all, give assistance to the acute situation, as well as with more study, begin to elevate their base level of health sufficiently to reduce the number of occurrences and the severity of it when it does occur. And then lastly, this one about palliative therapy. Here in the United States right now, there's over 450 oncology centers that are using some homeopathic medicines in their facilities, not just for the nausea of chemotherapy, but the biggest one is a topical calendula, if you're familiar with it, that's used in radiation therapy and breast cancer patients especially. The Oncology Nurse Society has made a strong case preferring it over trolamine, a great assistance to keeping women on course during the treatment of breast cancer through radiation. But here on palliative therapy and chemotherapy, I want to slash this next slide because this just became available yesterday, by the way, Hillary, which is there is a 1-hour credited free course in palliative therapy in homeopathy and palliative therapy oncology. It was conducted by Pam Tarlow through the Loma Linda University in Southern California. We just got the link, and I will send the live link also to Hillary and Linda to share with the ACA team. It's a little bit of jumping into the deep end, but any knowledge can be applied in other arenas too. So it's not exclusive necessarily to the nausea of chemotherapy. You can also use the same medicine for the nausea of a hangover. So it has multiple uses, but I'll make sure to send this to you as well. Now to the manufacturing and this one word that you see up there, succussion. I'm going to hit on this a couple of times because of its importance, but if you're not at all familiar with the manufacturing in its simplest, homeopathic medicines are primarily made from the plant, mineral, and biological kingdom. From that, a hydroalcoholic solution, some form of a tincture, we often say mother tincture, is created. From that, there is serial dilution of these medicines, and then the final in medicine is put into a variety of different forms: pellets, tablets, lozenges, syrups, topical ointments, etc. Now, even though I said serial dilution, we have a lot of the people most curious or skeptical about homeopathy is that they don't realize that the manufacturing process is a unique combination of both dilution, where they get stuck on that word, and succussion. First, like I said, there's serial dilution, and this means diluting it at this very significant ratio of 1% to 99 parts hydroalcoholic solution. And then this little symbol here is this succussion. I'm going to show you a video in just a second. But you continue this until our critics, without knowing what the word succussion or even that is part of the process, really become confused. But we see that this is the process. But next is this succussion process. It is now mechanized. It is precise. Well, I'll just let you see this and we'll go from here.
Once the homeopathic mother tincture or the first liquid dilution is obtained, one can start the dilution process. To do this, 1 part of mother tincture is diluted in 99 parts of hydroalcoholic solution. The liquid is then vigorously shaken in a calibrated device. This process is called succussion. The result is called 1C. It is then repeated to prepare the recurring dilutions, 30 times for instance, to get a 30C. The dilutions are processed inside laminar flow enclosures in an extremely pure atmosphere.
All right. The video pictures are 1,000 words. Without that process, our skeptics have a point. It's just diluted. But the dynamizing process that's conveyed through the succussion process has been tested. There's research that shows that unsuccussed material shows differently than succussed material. Even the different levels of succussion appear differently when analyzed. So very important point there. And again, keeping on, because I want to touch on this one last point before we get on to the use of homeopathy in allergies and during the spring summer season. Everybody should rightly ask, is there any amount of research? Because even within the field of homeopathy, there's a lot of practitioners who don't know that how much there is, what the nature of it is, or more importantly, where to find it. So if you are research oriented, if you enjoy this in any degree, please, again, reach out to me. We have the resources for you to go directly to the more valuable research that has been done. This report right here is worthy of note. It was done in France, which is where our laboratories were about a little over 10 years ago. It was a very large independent project. Over 8,000 patients, over 800 physicians, and the trial was broken out in this way. First, there were 3 different conditions being addressed. Musculoskeletal, there was upper respiratory infections, and then sleep anxiety and depression issues. Now, these 3 conditions were addressed either by a physician who used conventional medicine only, or by a conventional medicine practitioner who knew a little bit about homeopathy, or by those who were very well trained in an extensive medical training program in Europe called the CEDH, the Center for the Education and Development of Homeopathy. It's about a 130-hour program, but physicians who use homeopathic medicines exclusively. So these are the 3 different groups. Those are the 3 different conditions, and here is the short takeaway. What you see is that after the 8,000 patients, there's really about a little over 3,000 that are considered valuable to retain results from. But the takeaway you see down here, when it comes to musculoskeletal issues, using homeopathy allowed for a 50% reduction in the use of NSAIDs and other opioids. Of course, you use fewer drugs, there's fewer side effects. In the matter of upper respiratory, they use, again, about half as many antibiotics or fever medicines in the treatment of respiratory illnesses. And when it came to psychotropic drugs for people with depression, anxiety, they used 1/3 as many of the psychotropic drugs that were available. Short takeaway for the French medical societies and the French health agencies comes from this doctor here, who says we can treat the same patients that have the same degree of illness, the severity of it, and we get the same improvement, which has the added benefits that we just listed, that there's fewer prescriptions needed. It didn't eliminate the use of all prescriptions, but it saved them for another or better time. And of course, we all are aware that the case is usually that the fewer drugs, the fewer there are the side effects that accompany it. And then, of course, for the health agencies, significant cost savings. This cost savings type of analysis has also been done in several other countries, including Italy, where they had rather profound results as well. So there's much more when it comes to research on homeopathy, some of it really quite interesting, some of it really a little unusual, but it is a field in which the homeopathic community is very much aware we have work to do. And we do have groups to guide you to: the American Association of Homeopathic Pharmacists, the Homeopathic Research Institute that's based in England, very reliable sources of more information. Now, this is all the information. Like I said, I'm again happy to forward it on to Hillary and Linda for dispersion amongst the ACA. Now let's get on to the topic of the day. Allergies. What can homeopathy do during the allergy season? This first slide might be one of the key takeaways for the day today. There is a medicine made from histaminum source. Histaminum hydrochloride is the name in homeopathy. And French physicians use this, they use systematically. So if any physician has a patient who just knows that when the hydrangeas bloom, her allergies kick into gear full tilt. And they always bloom in her part of Paris sometime around the 1st of April. The protocol here is to give her 5 pellets morning and night for the 2 weeks prior to April 1st. The idea is to reduce sensitivity. And this is, like I said, it's a key takeaway. I have seen and used this frequently, and it's a very easy addition to any protocol that the patient might be on, because of the benefits that we mentioned before. There's no interference with any other therapy. And if there's somebody who refuses any other therapy except something, quote, natural, this is a very good place to start. And like I said, there is prophylactic benefit from it. Here is the protocol. And again, remember, you'll get this slide so you can print this out and have it for future use. But it's really pretty simple. Running, with a 2-week run up to where you think the season's going to be. It's a little variable. I know it's difficult to predict, but this also doesn't have to be the springtime. There are fall allergies now, many fall allergy sufferers who maybe around Labor Day would need to begin taking histamine in this potency. During the season itself, because histamine hydrochloride is not a guaranteed success for absolutely everybody every time, it is possible for some of the more severe sufferers that they may want to take when whatever it is that comes into full bloom, return to taking histamine morning and night. But also we're going to take a look at what are called branded formulas, like Allergy, which has a multitude of different medicines, and then the directions there on the package suggest rapid fire treatment every 15 minutes for an hour to address the violence, the suddenness of the onset, as allergies often are. People can step out of their car, be absolutely fine, get a nose full of whatever they just drove into in a different neighborhood, and it just launches. In order to address that, you do want to take repeated doses at the very beginning, and then afterwards you can move on to 2 or 3 times a day. Now, thinking back to our principle of similars, let's think about this very first medicine here that's being offered up as a hay fever medicine. Allium cepa, I believe, is probably on your shelf, Hillary. But Allium cepa, if your Latin is pretty good, comes from the red onion. And now we can just imagine that we are all, I don't know, we're all sitting around a table together, all of us, with a 50-pound bag of red onions. Everybody gets a nice big cleaver, and we start chopping up one red onion after another in a closed room like Ome is sitting in right now. What happens to us when we get too much of this natural substance? Well, most of us, our eyes are going to water, it's going to sting, our nose is going to start running, and we're all going to feel better if we would just open the windows and get fresh air. This is the red onion, the effects of getting too much of it. And so when we take the red onion, we take a mother tincture of it and run it through our unique manufacturing process. We can create a homeopathic medicine, Allium cepa, and give it to someone whose allergies look like this in particular. Now, you'll notice that there's some real fine tuning between the different medicines, because the next one that we have come up here is Sabadilla. Again, made from a plant. This one uniquely has a hyper sensitivity to just the smell of flowers, not just the pollen from the flowers, but their nose seems to be super sharp during the allergy season, which usually is the opposite, because so often our senses are dulled. But here, not only that, they have that peculiar, and maybe someone has seen this. You'll have a patient who comes in and says, I want to put my finger and scratch the back of my throat. That itching of the soft palate is a key symptom of the medicine Sabadilla. Next, for conjunctivitis, but allergies as well, is Euphrasia officinalis. This comes from the plant eyebright, and so not surprisingly, it has a long history of an affinity for our eyes. But noticeably here, and I'm going to slide back here, The discharge from the runny nose is irritating from the nose to our upper lip with allium cepa, which stands in contrast to the burning discharge from the eyes. So with euphrasia would be indicated when your tears come down and at the corner of your eyes, it seems like that's where there's little bits of redness and increased irritation, whereas the nasal discharge is not irritating at all. Gets to be a little challenging at this point with a patient standing in front of you. But now we're just going to skip on because we're going to come back around to Apis mellifica, which we talked about before. And we talked about how it can be used with hives and bee stings and cold sores, but conjunctivitis is another condition where Apis can step in. And not surprisingly, you're going to see that it comes on fairly suddenly, that it does both burn and sting here. But also, these are people who really want that ice cold cloth out of the freezer to put on their eyes to get some measure of relief from the pain. Now, we've now rather quickly gone through 4 homeopathic medicines, euphrasia and apis, allium cepa and sabadilla, and all 4 of these are single medicines. We use the term single medicines because they are made from a single source, whether it be plant or biological in these cases, but it's just one substance, and they are generics. Single medicines in homeopathy, no one can patent them. Boron doesn't own a patent on it because we can't have a patent on the eyebright flower. We can't have a patent on a bumblebee. So these are generics by definition. Move on to 2 others, Urtica urens, and again, Apis is mentioned here again, but Urtica is from stinging nettles. So we're no surprise to find that in its homeopathic form, again, it has usefulness, this time more with the allergies in skin allergies, where you see the key indication here is unbearable pruritus. It itches so bad, they just scratch and scratch. But standing in contrast to Apis, which showed improvement with really cold water, Urtica urens receive some measure of relief when they can run their arm under hot or warm water, maybe even a warm shower. However, they're confounded by the fact that it actually is irritated by having anything at all on them. So they're left not to use water, but actually to put some sort of radiant heat for some small measure. But this takes us back to this really unbearable itching that you see in Urtica. And Apis, again, we see as a repeat here for hives. Now, this is quite a lot in a short time when you're looking at this many single medicines. So what do you do when you're a pharmacist and you're in a busy store and you have just not enough time, or the patient isn't able to relay information to you that's suitable for making a choice of a single medicine? And here is where what are referred to as specialty formulas, and these are combinations of many of these medicines that we just looked at into a tablet form. Now, the advantage, again, because these are OTC drugs, there are clear indications for use, along with some of the benefits as well as NDC numbers and so on. But on the back of the box is obviously the directions for use, etc. But it lists many of these. We saw allium cepa already discussed. We saw euphrasia. We know histaminum and sabadilla. These formulas are derived by pharmacists and physicians, really for ease of use. What we just said there a moment ago. What do you do when someone wants relief? They don't want a long conversation, and honestly, maybe they may not be forthcoming with valuable information. This is where the specialty formulas come into play, because when you take this multi-symptom approach in a branded formula, whether it's Boiron or anyone else's, you're going to see the ability to address a variety of symptoms all at once. Is this the preferred way? if the occasion demands it, it absolutely is. Can you use a single medicine and a specialty together? Yes, you can. So you can imagine that someone could at the time be also taking histamine and the 30C, as we discussed a little bit earlier. But you can see the whole range of things that you're able to address with a specialty formula. There's also the possibility that some of these formulas you may not have on your shelf at the time. Like you may not have Sabadilla on your shelf. I'm sure you don't, Hillary, by the way. But you can, however, still find it in the specialty formula itself. Now I'm going to skip back here one more time to hit on this little piece of knowledge, the principle of similars. Now, belladonna is worth it because it's a troubling little word in pharmacy, because people, if they're not aware that you're talking about the homeopathic form of belladonna, they're thinking about this deadly purple berry here, then you can have some real confusion. But if by some wild chance you were out in the woods and you decided to make yourself a cup of tea out of this very pretty looking purple berry for whatever reason, and you drank it, you would very quickly end up with a headache, and a bad one. Your face will flush. You will possibly even have convulsions, and your pupils will get wide. And don't be surprised if you start by breaking out in a real sweat, and all of it happens really quickly. Therefore, the homeopathic manufacturing of this plant into homeopathic belladonna will and can be used for a congestive headache, whatever its source is. But when it comes to mucous membranes, if there's hot and painful and headachy, you can think now of a sinus allergy presentation where someone doesn't have the faucets turned on, if you will. Their eyes aren't watering, their nose isn't running, they're not necessarily sneezing. What they have is really compacted. They can't blow their nose. The pain is intense through the forehead and the sinuses. And you can see now that belladonna is included in this formula for that stuffed, congested feeling, but other medicines are added as well. What these two medicines don't show you is that one is noticeably right-sided sinus, the other is noticeably left-sided sinus, with belladonna covering the whole frontal area especially. So it is a medicine to think of when it says sinus pressure headaches with congestion, where it isn't just uncomfortable, it actually hurts. So what you have again here, you can use the belladonna if it seems especially pointed and you're quite sure of the choice, or you have these much more patient-friendly and familiar because of the blister packing for one. And then the indications are not in Latin. They're in clear, friendly language. And this adds to the benefits that are listed here, because we didn't talk about non-drowsiness. And think of the number of patients that you have who really may have that as a first concern, whether it's a truck driver, airline pilot, or just a mom driving her kids to school. You cannot be dropping off from your allergy medicines. And this is what homeopathy can promise. I think most everybody here is probably familiar with arnica, so I won't go into it too much. This is just an extension of the allergy into summer season of challenges. But whenever you see somebody who's blowing their nose so much that it turns raw, think of calendula as just a topical support, because if they're giving them apis, whether it's for cold sores and anything else, this could be a time to use the calendula in the ointment form. If they have sunburn, don't use the heavier ointment. Think of the creams. The calendula cream, by the way, is the preferred carrier by the oncology nurses when there is the radiation burn in breast cancer. Arnica, it's the most commonly used medicine in the United States right now. Cosmetic surgeons, dental surgeons, orthopedic surgeons are using it pre and post. And of course, it's just for weekend warriors. The Major League Soccer teams use it, MLB, NBA. And it's for any kind of pain from overexertion where you're going to see swelling from injuries with stiffness. But now over a couple of other things that are allergies, and you're going to see them in the summertime. And again, we're going to just skip down and we're going to see Apis mellifica once again, because we know it's for bee stings, but it can be regardless of what you're stung by. You may not have known what little bug crawled on you when you're out hiking, but if it is definitely pink and it's raised and it stings and itches, but definitely you can feel just hovering your hand above it, there's a warmth at the site and feels better with a cold application. This is Apis mellifica. There is a sister medicine to Apis called Ledum palestre. This is a puncture wound medicine, which of course this is what a bee does to us. It punctures our skin. But in this case, Ledum is called for when the site isn't necessarily pinkish red, but it starts to turn sort of a mottled blue, purple, green kind of strangeness. Sometimes there might not be any color at all, but it feels not hot to the touch, but if you touch it, there is no increase in temperature in that locality. The use of Ledum preventatively to keep away bees is common amongst Spanish beekeepers. I don't know it personally, but I've heard the story many times. Now, here is one of those favorite little things from of mine from homeopathic literature from some time ago. This is an article written by a doctor in the 1950s. And for whatever reason, I mean, not surprisingly, there's a lot of mosquitoes in Florida. There was a big issue about what can we do about it, particularly as it affected the servicemen that were stationed there. And this homeopathic physician said, well, you know what, there's some history and even literature predating him from the 1950s that said this medicine, Staphylococcus aureus, which is a plant, the delphinium plant, that if you use it in one of these lower potencies, it seems to have the effect of keeping mosquitoes from biting you. Now, I read this in my pharmacy 30 years ago. And interestingly, Los Angeles does not have mosquitoes. It is a rarity to find mosquitoes in Los Angeles. So Los Angelinos who traveled, whether they were going to Alaska, where the mosquitoes are about the size of hummingbirds, Jamaica, or overseas, wherever they were going, they were always looking for something. I stumbled across this article. There's another one as well I don't have printed here for you, and said, let's give this a try. Over the course of the last 35 years, I'm sure that I've used this 100, 200 times. And I don't like to say always, and I don't like to say never, but this is a reliable option. And you use the Staphylococcus aureus in the lower potency, just because that's what they told me to do at the very beginning. It's what I've done, and it works. And what you tell the people to do is take, you're going to have a few tablets if it's going to be a few tubes. If you're going to be traveling on a 2-week vacation, let's say, and you've got a family of 4, but you just start taking 5 pellets twice a day, just start the day before. And then obviously, if you're on the plane leaving Colombia, then you can certainly stop it once you're on the plane. I have seen this work in my own family. I have used it myself, and it, for whatever reason, keeps the mosquitoes away. Doesn't mean you can't do the other things. You can eat more bananas or take whatever else you can ingest to help it. But Staphylococcus aureus in low potency is really quite a nice little clinical pearl.
Question, Shane.
Yes.
So to reduce the tablet load, is there an option of going with a 30C equivalent of doing 5 tablets of 6E or no?
No, there isn't really. I don't think that there's any harm in it, but it isn't what I have seen in life. So no, to answer your question, translating from a 6C to a 30C does not allow you to use 1 pellet instead of 5. The numerics don't work out that way, but what you can do is just on the point of how many pellets, the pellets, 5 is what's recommended on all of our tubes, because that you have to standardize your indications for use and the directions for take. And we have found that remember we go back to the liquid that's sprayed onto these neutral pellets. There's a certain amount of liquid that is absorbed by 5 pellets, and that was accepted as the standard. However, in homeopathy, it is possible to use 3 pellets and still get equal effect. Does that help you with that one? But no, 30C does not translate to 1/5 as many pellets as a 6C. That would be convenient, but there's not unfortunately the case. And so as we come towards the end of the presentation here today, there is one more unusual bit of allergy medicine to think of in the spring and summertime, which is people who are especially sensitive to the sun. I don't know how often you see this. I saw it some in Los Angeles, not that common, but this is what we call a specific. This is a specific to this photosensitivity. The medicine is Hypericum perforatum. It's made from St. John's wort, the plant. And it really is, for as pictured here, the kind of excited redness that people get on the uncovered spots. They won't have this if they're wearing a long sleeve shirt, but if they wear a cutoff t-shirt, then yes, their shoulders and arms can exhibit this. Hypericum is just an important medicine anyway. Just to touch on it, but it's referred to as the arnica of the nerves. Like I told you, arnica is the most commonly used homeopathic medicine. It's a specific to the muscles and soft tissue, as the same way as Hypericum is a specific to the nervous system. So any sort of nerve injuries, whether you crush your fingers in the car door, or you stub your toe in the middle of the night, or there's sciatica or shingles or damage to your tailbone with a fall, Hypericum is the medicine to think of. But here for allergies, the most important thing is that it is a specific to people who suffer this kind of erythema from a lot of sun. And so I will leave you with this offer as well. We have, actually, I was speaking with Hillary and Linda prior. Our Boiron educational track, the non-commercial track, has made significant inroads with schools of pharmacy across the country. We're asked regularly to come and make presentations on homeopathy to the students, and a lot of students then immediately ask for more. And so we have built modules of all kinds for students, but we have them, they're expanded for independent pharmacies, for your staff, your pharmacists and technicians. And these are just some of the modules that are available to you. We have this available to you in micro-learning sessions. We haven't set it up on a regular basis yet. We still allow you to customize it. So for instance, if Omei, you wanted to have Monday mornings at 8 a.m., 30 minutes on homeopathy once a month for the next 6 months, then this is what we can accommodate. We haven't set it up as a regular hour, mainly because this is a 3 time zone country and the challenges are considerable with the workload of pharmacists. But this is available to you. And again, my contact information will be shared with you by Hillary and Linda. And so lastly, I'll just say thank you all very, very much. If you have any interests in staff course trainings, reach out. And if you have if you're a school of pharmacy, we may already have reached into them, but if you have a school of pharmacy near you that you would like us to contact to help those students get started, just let me know, please. So I'll stop sharing there and ask, in the time that we have left here, is there any questions I can answer right now? Because you are welcome at any time to reach out and ask something more specific to your pharmacy needs.
All right.
Shane, this is all very new to me, so this might be a dumb question. Have you, my pharmacy is a compounding only pharmacy. Have you had any compounders incorporate any of your ingredients in any of the preparations in compounding? Or does it lose its effects if we attempt to?
I would say that it's rare, but I can't say that I know for sure, because it is possible that there are compounding pharmacists. We'll just use the calendula cream, for instance. If for some reason they wanted to have the benefits of calendula cream incorporated into a compound, they may not tell us. They may just use it selectively. They may use it for a special patient. But I know it has been done. I don't keep a really healthy record of anyone who tells me stories of using it. So the answer is, I'm afraid, I don't know for sure, but we're happy to, maybe this is something that Hillary, you could speak to better than I.
I don't see why we wouldn't be able to. I do not have any experience either, but I could see that's a good point. I could see that we could put an active ingredient into more of a calendula cream type thing than using, pellets or whatever and putting it into. So, no, I will do some digging as well. That's a good point.
I remember that. Yeah, there's some pharmacists are practicing. Yeah, they are. The compounding pharmacists. They're doing it.
I'm not sure if he's unmuted or we're not hearing his question.
Yeah. He looks like a Kentucky Fried Chicken guy.
We can't, Sri Ramam, we cannot quite hear your question. You said, I heard the word sensitive type.
Oh boy.
Oh, now we hear you. All right. Well, I'll leave this open to you all. Please use us as a resource when it comes to the topic of homeopathic medicine. Any question comes up, fire it off. We'll be happy to do some of the hunting for you, because chances are I know where to locate it. And Hillary and Linda, thank you very much. I'll leave it to you to close out as you will for your monthly webinar.
Thank you so much for being with us. I learned new things as always, so I appreciate that. And then we're looking forward to seeing you at our meeting in September, right?
Yes, we will.
So thank
I
you.
look forward to seeing you then.
And then
All right.
thank you for all the information too. If you could send that to Linda and I, we could pass that off and share with our members.
You got it. I will do that right away.
All right. I think we're good.
Thank you all very much.